Good afternoon, dear colleagues. My name is Anastasia Lapshina. I'm a doctor practicing in aesthetic medicine. I'm working with Innoaesthetics laboratory for more than 10 years, and I'm really very happy to be here today with you to discuss really very interesting topic. And I know that trichological treatments are really very popular, especially now during the autumn season. So today we are going to discuss some protocols, some products which are really very effective that will help you to work with your patients in a very effective way to get really great results. I know that most of you already are working with the trichological products of Innoaesthetics. I saw the results that you were sharing all over the world because I'm doing this training, see your pictures before and after. So today we will just summarize the most effective treatments, and we will discuss the most effective products that you can use in order to obtain really great results. So first of all, I would like to share with you the results that you can get after using of products like Hair Loss Control or Hair Vital. Here you can see a patient with alopecia and the result after 4 sessions and 8 sessions of hair loss control. So as you can see, there is a significant improvement in the density of the hair even after 4 sessions of mesotherapy. Here you can see the trichoscopy, and also we see that not only the situation with the density is much better, also the quality of hair is better. There are much hair shafts growing from one hair follicle. Here again, the thickness of the hair is much better, the quality of hair is better. Again, patient after 4 sessions and 8 sessions of hair loss control. So actually, this is the treatment which lasted for 2 months. Improvement in the quality of hair, density of hair, significant improvement that we can see on the trichoscopy. In the case of both telogenic alopecia and androgenic alopecia. This is the patient after 8 sessions. Improvement in thickness of hair, improvement that we also can see in the trichoscopy. This is already Hair Vital. And 8 sessions. So as you can see, mostly all the patients that you can see here, they had around 8 sessions, so it was treatments of 2 months. So before talking about the products, let's discuss the main types of the alopecia that we are working with. And of course, mostly we are working with the patients with androgenic or telogenic alopecia. Talking about androgenic alopecia, we have to understand that this is, unfortunately, is the problem not only of men. This is also a situation which can happen with women. In the case of different hormonal disbalances, let's say, in the case of polycystic ovaries, but mostly, of course, androgenic alopecia is the problem which is more more male patients we have with this problem. So what we can see in this case, in the case of androgenic alopecia, it is mostly thinning of hair and loss of hair in the parietal part of the scalp, also in the temple regions. During the trichoscopy, we can diagnose the miniaturization of hair follicles. And of course, the reason of such a problem is the hyperactivity of 5-alpha reductase. And we know that 5-alpha reductase is the enzyme which is responsible for the transformation of testosterone into its active form, dihydrotestosterone. So in the case It's really hyperactivated. That can be in the case of male patient or during the hormonal disbalance in the case of female patient. We will have this androgenetic alopecia. What else can we notice? So what is actually happening during the androgenetic alopecia? During the first year of this problem, there is a significant dystrophy of the follicle. So the size of the follicle mostly is reduced and hair becomes thinner. It becomes more fluffy, and sometimes we can see also discoloration. So it's not so dark as it was before. It's not so bright and shiny as it was before. On the other stages, on the stages 2 and 3, this dystrophy of the follicle progresses, and already happens the blockage of the anagen phase. So the follicle stops to produce, and the hair almost stops to grow. And in some period, we can see the appearance of the scar in the area of the dead follicle. So during the trichoscopy, we also can see white, yellow, or even brownish spots. So in the male, during the androgenetic alopecia, here you can see the areas which are usually prone to this kind of alopecia. Like I've already mentioned, that would be, it will start from the parietal area. Sometimes it can start from the frontal area, and temple region are the most common areas because this is the hormonal dependent area of, that's why here we have this androgenetic alopecia. In the case of both man, female, and male during the androgenetic alopecia, we will see the miniaturization of the hair follicle. There would be fluffy hair. The pigmentation of the hair will change, and also we can see that the hair will grow horizontally, so not vertically like it should be, but because of the thinning of the hair, it will grow horizontally. Well, also we can notice oily scalp. So sometimes patients who are coming with the hair loss, if you will ask them, how often do you have to wash your hair? They will say that usually that can be minimum once a day, sometimes several times a day. And again, this will be associated with 5-alpha reductase and hyperactivity of the sebaceous glands. So actually, this is something here in the case of androgenetic alopecia. We have something in common in the pathogenesis like we have in acne. Because in the case of acne, due to the hormonal disbalance, also there would be some changes in the production of sebum. There would be hyperproduction of sebum. The quality of sebum would be completely different, and that will lead to the appearance of the acne lesions. Here also, because of the activity of 5-alpha reductase, testosterone will be transformed in a very active way into its active form, dihydrotestosterone. And because of this, our patients will lose hair. So what else would be very characteristic for the trichoscopy? On the trichoscopy also we can notice brown pigmentation and yellow pigmentation. So actually this is usually happens in the areas of the dead hair follicles. As for the female androgenetic alopecia, also that can be noticed mostly in the parietal area, in the temple region, as for the man. And on the trichoscopy, we can see that in one spot, or maybe in 1 square centimeter, we can see more than 4 yellow spots or even some brown spots. Decrease in the average hair diameter in the frontal area, in the parietal area, in the temple region, and very thin hair. That is androgenetic alopecia. So with androgenetic alopecia, we work with both with men and women, but in the case of androgenetic alopecia, we need really specific ingredients that will block 5-alpha reductase. This is the main actually what we need, so we need to cope somehow with the hormonal disbalance. As for the telogen hair loss, this is a bit different problem, which is mostly happening during spring and autumn. That is why now we have these kind of patients with the telogen hair loss. So what would be the difference? What we will see, for example, during the trichoscopy of such kind of patients? Mostly the pronounced weakening would be in temporal region. It can be also in the occipital region, but mainly the loss of the hair would be more or less even all over the head. So this is different. This is the difference with the androgenic alopecia, because in the case of androgenic, we have hormonal dependent areas and hormonal independent areas. With the telogen hair loss, we will see the loss of the hair more or less in every region of the scalp. Also, we can notice the empty follicles. The hair will grow vertically, so it will not grow in horizontally like during the androgenic alopecia, because it will not be so weak. So there is a loss of the hair, but the quality of hair can stay as good as it was before the hair loss. Also, there can be some changes in the skin around follicle. The pigmentation can be lighter, and the thickness of the hair shafts also will change. So mostly there are two types of the telogen hair loss. There can be acute hair loss and chronic hair loss. Active hair loss is the hair loss which can be characterized by approximately loss of the hair during 3-4 months after some cause, after some trigger. But normally it usually resolves in 6 months. So actually it can happen after some intoxication. It can happen after some disease. Remember what was happening with our patient during the COVID times. There were a lot of patients who were coming and telling that they are losing their hair, and if you will try to gather their anamnesis, usually they were telling that yes, in the past they have COVID around 3 months ago, around 4 months ago. Also, what can happen? It can be, the reason can be, for example, really acute but strong stress. Also, we can see such patients which are coming with this problem. But there are really good news that usually in the case of the acute telogen hair loss, everything goes well in around 6 months. So for such kind of patient, we just need to we just need to support their hair. So for that, we can recommend them to use some products for home use. We also can recommend to do more sport. We can recommend to drink more water, to move more, to do massages in order to improve microcirculations, to take some nutraceuticals with vitamins, with some cofactors, maybe with some amino acids, and usually it really works very well. But in the case of chronic telogen alopecia is the case where patient will say that something happened around 6 months ago. He started to lose his hair, but it didn't change. So even after 6 months, the situation didn't change. He's still losing hair. Usually such kind of patients will say that they can notice a lot of hair on the brush. They can notice a lot of hair during washing hair. Also, they can find their hair on the pillow and so on. So here it's really very important to find the main reasons, to find the main etiological factor. And the main etiological factors could be some kind of deficiencies, for example, iron deficiency, zinc deficiency. That could be patients with protein deficiency. Now there are a lot of such kind of patients, especially those who are keeping very strict diet, who are not eating meat, and at the same time, they are not taking some nutraceuticals with the proteins. There could be the patients with the diseases of thyroid gland, and some kind of patients with the gastrointestinal tract diseases. So in the case when the patient really eating proteins, taking some nutraceuticals, but because of the diseases of the gastrointestinal tract, it is not absorbed in the body. So this also can be the reason of the chronic telogen hair loss. And in this case, of course, we need some complex therapy. So first of all, in order to before starting to work with the patient in clinic, before starting to do professional treatments like mesotherapy, we have to give some common recommendations which will also help and improve the situation with the hair loss. So we recommend to massage the scalp daily. This is really very important because this is something that will help to improve microcirculation. And as you know, microcirculation, of course, is crucial for the normal hair growth because this is the nutrition of the hair follicle. This is the income of all the nutrients for the hair. So this is really something very, very important. Elimination of hypodynamia and recommendation of moving more, doing some sports, yoga, stretching, doing some general massage, sauna bath is also very good for the improvement of microcirculation. Drinking water is also very important because sometimes there can be some rheological problems in the case of hair loss. That is why drinking water during the day, I'm not talking now about liquid food like soups or eating vegetables. Also, it is very important to drink just pure water in order to improve rheological characteristics of the blood. And some superficial cosmetics. So it is also very important to use masks, to use conditioners, to use everything that can nourish the hair, nourish hair superficially, can nourish the skin superficially, and improve, let's say, the quality of hair from outside. But of course, in order really to improve quality of hair, in order to stop losing of hair, the best way of treatment would be mesotherapy, would be superficial injections, let's say, because in the case of hair loss, we have to deal with the follicle. So everything which is happening outside, everything which is happening with the hair itself is already the consequence. The reason is always inside. So the reason is always in the deep. In order to be deep, we have to put the active ingredients just to the area of the hair follicle. So this is actually our targeted area. That is why it's great that we have such kind of therapy like mesotherapy, which gives us the opportunity to put the active ingredients just to the layer where we want to be active, where we want to store the active ingredients, where we can improve microcirculation, where we can put the nutritions in order really to stimulate hair growth and to stop hair loss. So mesotherapy, that would be, let's say, one of the most effective treatments. But in the case we will have a complex treatment, like taking nutritions, recommendations of using hair lotion, for example, so also topical treatment, recommendations as for the massages and so on. So doing such kind of complex treatment, of course, will be much more successful and will give you the results much faster. So for the patients with the hair loss, especially in the case of androgenic hair loss for both men and women, we have product hair loss control. So I would say that for male patients, I will use hair loss control in all the cases of the loss of hair, because in the case when we are working with men, we always have to deal with the dihydrotestosterone. So in this case, we always will need the effect of the inhibition of the 5-alpha reductase. So here, if you will pay attention to the active ingredients, you will see that we have here fenugreek, capixyl, saw-palmetto, azelaic acid, pyridoxine, and zinc. So actually, azelaic acid, pyridoxine, and zinc is the complex which will block or slow down the activity of 5-alpha reductase. Let's see more precisely what we will get of all active ingredients. So fenugreek is the ingredient that will stimulate the microcirculation. So this is actually something which will help to improve the oxygenation of the hair follicle, nutrition of the hair follicle, and it also the ingredients which will interfere into the metabolism of the dihydrotestosterone. Capixyl is actually the innovative active ingredient. Capixyl is the biomimetic peptide, which is combined with the extract of the red clover. So it has different properties. First of all, again, it will slow down the activity of the 5-alpha reductase. It also improves the integrity of the extracellular matrix protein, so it will help to integrate them. And capixyl is the peptide which is responsible for the increase of the density of hair in the anagen phase, which is also really very important. So here you can see this complex of azelaic acid, pyridoxine is zinc, which is responsible for the slowing down the transformation of testosterone into its active phase dihydrotestosterone. That's why we can use it for both male and female in the case of androgenetic alopecia. And saw-palmetto, I'm sure that if you're working with the patients with hair loss, if you're working with the other products, you've noticed that saw-palmetto is really very effective active ingredient that is used in a lot of products for treatment of hair loss, because it inhibits 5-alpha reductase. It also improves microcirculation. So this is really very active ingredient. So what would be the protocol of using of hair loss control? Normally it is recommended to use it once a week during 8 weeks. But the first results you already will see on the 3rd, 4th session. The full protocol of treatment would be around 2 months for both men and women. So it's possible also to do these treatments once in 10 days, if there is no time, if there is no possibility for the patient to come. Also, you can do it once in 2 weeks, but I wouldn't recommend you, because doing it once a week, 8 sessions, that's already 2 months. So if the interval would be longer, then such kind of treatment would be also during 3 or 4 months, which is also not very convenient for the patient. And such kind of circle we can repeat during 6 months. So as for the efficacy of this treatment, as I've already mentioned, really we can see the first results on the 3rd, 4th treatment. What your patients can notice. So here be very attentive, and this is something that you have to explain to your patients during the first consultations, that during the first treatments, the first effect that they will see, maybe they will notice that they are losing even more hair. This is something normal. That's something that the patient should be aware of, not to be scared. So usually that can happen during 1-2 weeks, but then after that, they will already see the new hair growing. So actually losing more hair shows that the product is working and we already stimulating the hair. So that hair that already was in the phase of falling out, in the phase of catagen, it will fall out even more quickly than without treatment. So actually that's fine, and it's not something that we should be scared of. Then, as for men and women, of course, there is the difference in the effect. There is a difference in the maintenance of treatment. So with women, it's more easy. So with women, in the case of androgenic alopecia, we can get really good results. And for example, in case that we will understand really the etiological factors of the hormonal disbalance, like maybe there is polycystic ovaries or something like that. So if there is the treatment of the main problem in the body that led to this hormonal disbalance, then of course the problem of the androgenic alopecia will be solved very quickly. In the case of male patients, unfortunately, it is not possible to obtain really long results without any treatment. So I would say that once a male patient is having androgenic alopecia, this is the case that we have to treat almost lifelong. I'm not saying that we should do mesotherapy all the time, but at least once a year, it's important to do mesotherapy treatments with the products like hair loss control. And then we can recommend, for example, hair lotion in order to maintain and improve the results that we got after professional treatments in clinic. This is something which is really very important. And again, maybe it will be something that the patient should use for the lifetime. In the case of male patients, unfortunately, that's something not very easy to treat. So here you can see how it's possible to inject hair loss control with the help of needle. But we also can do it with the micro needling. It's actually up to you, up to the regulations in your country. We just understand that the product is sterile. That's why it's also possible to inject it in the dermis. So here I'm using the needle 32G, 6 millimeters, but again, that's up to a specialist what kind of needle is comfortable for you, because it can be 32G 4 millimeters, for example. We are injecting the product evenly all over the head, but you can inject a little bit more of product in the problematic areas, like here I'm doing in the frontal region. Okay, the other product that we can use in the case of trichological treatments would be Hair Vital. And Hair Vital is mostly the product which is used for the telogen alopecia. So here, pay attention to the active ingredients. So here we have trace elements, enzymes, peptides, vitamins, amino acids. So actually, all these ingredients would work like the building material for hair. That's why if you have female patients who are coming to you, maybe they even don't have any problems. I'm sure you also have such patients who are coming and saying that I'm happy with my hair. I don't have any problems with the growth of hair. I just want to prevent any kind of problems. I just want to support my hair. So in this case, you would choose Hair Vital. Also, in the case of telogenic alopecia during spring period or autumn period, When we have hypovitaminosis, when we have avitaminosis, that would again be Hair Vital. If there are patients after some acute stress, after some intoxication, again, you can choose Hair Vital. So here we have amino acids like taurine, methionine, arginine, cysteine, which are the main amino acids in order to compound keratin, in order to prevent alopecia. Also, those which would work like antioxidants, which is also very important in order to prevent any damage of the cell, which can be caused by free radicals. Trace elements that we have here and enzymes usually work, or also vitamins, usually work like the cofactors of the synthesis of proteins. So here we will help the metabolism, we will improve metabolism of the cells, we will moisturize keratin, stimulate synthesis of collagen, stimulate the proliferation of the cells, which is really very, very important if we are stimulating the growth of the hair. Adenosine is the ingredient which promotes growth of the hair really in a very significant way because it's stimulating the growth factors. So as for the treatment protocol, here again, it's recommended 8 sessions with the interval 7 days. So once a week we are doing a treatment, but everything will depend on the patient. So in this case, with the telogen alopecia, also with the patient who want just to maintain the quality of hair, which they are already happy with, sometimes it would be enough even 5 sessions. So you have to evaluate really, for example, there are patients to whom would be enough to do once a year or twice a year during spring or autumn, a cycle of 5 sessions. That would be completely enough. But in the case you see that you are working with the patient with the chronic telogenic alopecia, then in this case I would recommend to do 8 sessions with a 7 days interval. So here you can see how it's possible to apply it with the help of microneedling. Of course, if you prefer to inject with the needle, then no problem. You can do it with the needle. With the needle, we usually do or middle nappage technique, deep nappage technique, or micropapule technique. In the case you are working with the microneedling, okay, no problem. You can do it with the microneedling, as you can see here. So we are using some quantity of the product and then applying it with the microneedling. The treatment should be done all over the head, but we pay more attention to the problematic areas. Like also you can see here in the frontal region, we have the areas with the fluffy hair. Okay, additionally, what we can recommend to the patient. Hair lotion is really a product which I recommend you to use. This is a very effective treatment of hair loss. To tell the truth, I would say that this is usually one of the best sellers in the clinics if you really have it, because most of the patients have these or that trichological issues. And hair loss and hair lotion really works great. So you can see the first results just after starting use. And once the patient try this product, after that you don't have to convince them to buy it, to use it more, because they already can see the results and they are willing to buy it, they are willing to use it for a long time. Also, I would say that this is the great option for male patients. Because in the case of female patients, they are usually ready to do any kind of treatments. They are okay with mesotherapy. They're okay with microneedling. They will come every week to do treatments. In the case of male, usually no. They don't want to feel any pain. They don't want to have any kind of uncomfortable treatments. Also, they don't want these long-term treatments. So it's really a bit issue to have a male patient to explain that he has to come to clinic for minimum 2 months. But in the case with the hair lotion, it's really very convenient for everyone. So they are using that once or twice a day. They are seeing the results. It's very comfortable. It's completely without any pain. So this is the product that I really recommend you to try if you didn't use it yet. So the active ingredients that we have in this lotion are curcuma longa, that prevents and reduces hair loss. Also, it will promote the growth cycle of hair, stimulating blood circulation. So again, this will be the stimulation of the oxygenation of the hair follicle and getting nutrition. Azelaic acid and zinc, we have already discussed. This is the combination of the inhibitors of the 5-alpha reductase. That's why hair lotion can be used in both cases, in the case of telogenic and androgenic alopecia. Also, there is a complex that we already saw before, Capixil, the combination of the tetrapeptide 3 and red clover, which stimulate collagen production, inhibits 5-alpha reductase, stimulate proteins of the extracellular matrix. So actually, this is really very effective and complex stimulation of the growth of the hair. Caffeine is the ingredient which is in use, which reduce the activity of 5-alpha reductase and stimulates and promotes the proliferation of the cell. Niacinamide will activate microcirculation and promote hair loss, and promote hair growth. So hair lotion, I really can recommend you. It's very comfortable to use, so it's not oily. I would say that the complexion is rather liquid. That's why it can be used both in the morning and in the evening. It will not make hair looking more oily or something like that. It's completely comfortable. That's why we have a pipette inside. We just have to drop it on the scalp and massage into the skin very gently. I would say that already in 2 weeks, your patients will see the results, that for sure. In the case of androgenic alopecia, hair lotion can be used instantly, especially for men. In the case of telogenic alopecia, hair lotion is used just during 2 months during the acute period of the hair loss. And another product that we have for the trichological treatment would be Hair Scalpeel HRP, which is also the product that patients will use at home in the cases of appearance of dandruff, seborrheic dermatitis, and also alopecia. So the active ingredients that we have here are salicylic acid, resorcinol, panthenol, biotin, pyrectone, and selenium sulfate. So how it works, the mechanism of action. As you know, salicylic acid is the keratolytic ingredient. So it will stimulate the exfoliation, the removal of the superficial layers of the skin. So actually, in the case of seborrheic dermatitis, in the case of dandruff, it will also help to get rid of these dead cells on the surface of the skin. It will stimulate the turnover of the cell of the epidermis. And also it possesses some antimicrobial activity, which is also very important during the treatment of seborrheic dermatitis, also for the prevention of any kind of microbic development on the skin. Also, there is resorcinol here, which possesses antimicrobic, keratolytic activity, and biotin is the ingredient which works like coenzyme, stimulating some processes of metabolism. It will also improve the quality of skin during the treatment of seborrheic dermatitis. Panthenol is the ingredient which will hydrate the skin. So as you know, panthenol, of course, is very effective for dry skin, for rough skin, in the case of erythema, also for soothing the skin. That's why here we have this soothing ingredient. There were conducted clinical trials with around 50 patients to evaluate the effect of the panthenol and biotin on the scalp, on the skin of the head. And they were using this, the complex of these ingredients during 8 weeks. So after 8 weeks, we can see the reduction of hair loss, and we also noticed the improvement of density of the hair. Also, pay attention that here we have pyroxene. Pyroxene is the ingredient which inhibits the synthesis of ergosterol, and ergosterol is the main component of the cell wall of most of the fungus. So actually, this is great product in the case of dandruff also, because also if patients have any kind of fungus, like the main etiological factor of their trichological problems, then this product would be really very effective. So it works like an antifungal ingredient. It improves hair condition. It doesn't have any kind of adverse effect. And the other active ingredients that are in this product are selenium sulfide, which reduce itching or irritation, which also can be like issue for the patient in the case of dandruff, in the case of seborrheic dermatitis, and also it has antifungal activity. So here, as you can see, the main indications are seborrheic dermatitis of the scalp and alopecia, but usually alopecia is already like the consequence of the seborrheic dermatitis, or the consequence of the fungi infection. That's why in the case we already have alopecia, which was caused by these problems, of course, we can use this product, but the next step would be treatment with the hair loss control or hair vital. It's also very convenient for the patients because they can use this product at home. They will already see the results as improvement of the quality of the skin of the head, hydration of the skin, hydration of the hair. It's recommended to use that during minimum 2 weeks, but better to do it during 1-2 months, and patients really will see very, very good results. So how to use it? First of all, usually it's recommended to use it for the clean skin, of course, for the clean hair, and it's recommended to moisten the hair and scalp before applying. Then there is a special pipette on every vial of the product, so it is recommended to apply it with the help of the applicator to the scalp, just part by part, and to massage it during around 5 minutes. Pay attention that it is recommended to use half of the vial. So normally that would be enough. One vial we are using for several applications, usually for 2 applications. After the applications, we are leaving the product for 10-15 minutes, waiting for the absorption, waiting for the activation of all the processes, and after that time it's better to rinse it with the shampoo. So that's why it's up to patient when to use it, in the evening or in the morning. It doesn't matter, to tell the truth, just it should be comfortable for the patient. And it's recommended to do every day, minimum 2 weeks. So this is the main protocols. These are the main products that you can use for your patient, both in the clinic or to recommend to your patients to use it at home in order to maintain the results that you already obtained in the clinic. Or sometimes home care, it's just something that the patient can use instead of professional treatment if unfortunately they don't have the opportunity to visit you, for example, every week, or like I've already told, not all the male patients are really eager to have some kind of mesotherapy treatment, injection treatment. Sometimes for them it can be really painful. So in Innoaesthetics we have both possibilities. We have the opportunity to use professional products, home products, and really in a very short period you will see very good results. So in the beginning I told that I know that most of you are using this product. You really have very good results. You are sharing with these results on the training. You are showing pictures before and after. So this is really great. If you still didn't use this product, if you, I really recommend you, if you have any kind of questions, you always can write to your distributor. You also can write to Skin Academy. We will be happy to provide you with all the protocols, with all the explanations. We will answer all your questions. So that's why we are keeping in touch all the time with you. If you have any questions, you can write that in the chat and we can discuss it. Maybe you want to share your experience that you used, what kind of results did you get, or maybe you have some questions about using of the product. If you don't have questions, then I'm very grateful for your time, for your participation in this webinar. I hope that you got some useful information for you, some important information that will help you to obtain really good results in the trichological treatment. And I will see you on our next webinars. We will have also in some weeks, we will have really very interesting topics. We will talk about the innovations of Innoaesthetics laboratory, like exosomes. By the way, come on the webinar about exosomes, because actually exosomes is already the product, also the product that you can use for the trichological treatments, and that will also improve your results. So this is also the way of combining exosomes with TDS products that we were talking now, or even without TDS products, you can use exosomes, because this is a great stimulation of the growth factors. And this is the new product, but I already saw doctors who were sharing with me great results, like only after 3 treatments, they had perfect results of the treatment of trichological patients. That is why please take it into consideration. Don't forget about exosomes, and you also can add exosomes to your portfolio of the treatment of trichological patients. There was the question from the Philippines where we can buy the product. So in the Philippines, we have a distributor. So or please give us your contacts. You can write it here, maybe your email, and then the managers will contact with you, because we have an official distributor in Philippines, no problem, and you will get the products there. I'm not sure about the Ireland, but also please leave us your contacts, and we will keep in touch with you, or we will provide you the contacts of the official distributor there, or we will maybe find someone who is the nearest distributor to you. Yes, if you have my contacts, you also can contact with me, because I'm sure here we have some doctors who maybe participated in my trainings, no problem. You can contact me in Instagram. I will also share with you the contacts of the distributors, of the managers, of the official distributors where you can take the products. So thank you very much. I wish you a good day, and we'll see you soon on our next webinars, and next time we will discuss exosomes, so don't miss the webinar. Thank you very much, and bye bye. Also, we will have the video of this webinar, so anytime you also can rewatch it. If you forget something, that's not problem. Thank you so much. Bye.